My name is Cindy Shields, and I'm a policy analyst for early childhood at Advocates for Children of New Jersey, and I'm really happy to help hold this space for all of you. Prior to joining ACNJ in 2024, I was a provider for 31 years, holding every position from a teacher to the executive director at a YMCA, where we served over 1,000 children daily in 28 licensed programs, serving children from birth to 13 years of age. I did work in an Abbott and preschool expansion district, and I understand the challenges that you face every day. This community of practice grew out of the momentum of the community-based private provider conference. And it was created to give public preschool providers a space to connect, share ideas, and strengthen New Jersey's mixed delivery preschool system for the better. Because so many of the challenges you face are shared across programs and communities, we hope that this group can be a place for honest conversation, mutual support, and practical problem solving. I'm going to drop today's agenda in the chat and our group norms just so that you all have it for your reference. And I am going to go ahead and introduce our presenters for today. So the name of the presentation is The Big Step at 3, Supporting Children and Families to Navigate Early Intervention by Age 3. We have with us Allyson Mathews, Early Childhood Inclusion Project Coordinator at the Statewide Parent Advocacy Network, and her teammates Mita Bhattacharya, an Early Childhood Inclusion Coordinator, and Paulina Vargas, Bilingual Early Childhood Training and TA Specialist. Okay, Allyson, Mita, Paulina, it's all yours.
Thank you very much, Cindy. I'm going to start by echoing that thanks for you all taking the time to be here today. Mita and Paulina and I are on a team. We talk about this topic a lot with families, with professionals in English, in Spanish, and there are still so many people we haven't been able to reach out to. So thank you for coming today. I hope this really does support what you do, which is so important for families every day and children. Of course. So we're going to talk about the steps for early intervention, and we're going to presume we're talking about children already in early intervention, so we can really just focus on the transition piece and ways that you can support the families during this process. Plus, we'll have resources to share with you, and we can also have those available through Cindy as well, that she can share out with you in email after the fact. First, I'm going.
Allyson, you just got muted.
So sorry. This is a little different sharing this way. Okay, good. I think we're good. I'd like to introduce, as I said, I'm Allyson. We have Mita and Paulina here. I'm highlighting this. This is their roles in SPAN for the Inclusive Childcare Project. I'm going to take a step backwards and talk to you about SPAN first, and then I'll talk about this project. But SPAN is here as the Parent Training and Information Center for the state of New Jersey. Every state and territory in the United States has one. In New Jersey, we're pretty much all under one umbrella, and we empower families, youth, and young adults, involve and perform professionals and others interested in the healthy development and education of children. What we're trying to do here in this project is work with the youngest children. However, what we do at SPAN may go up until a child becomes a young adult, even up to the mid-20s. And on that front, Paulina and Mita are also sitting on a project where they support families with a lot of healthcare and special education needs. So that's another project that they work in conjunction with the Special Child Health Case Management Units. And this today, we're here on behalf of NJICCP, which is the Inclusive Childcare Project. We haven't really tooted our horn, but we're 30 years old. I'm pretty sure this started in 1996. So this is our 30th year of supporting people just like you and the families you serve, because there is a gap that professionals and families are more supported in the Part B system, in the actual preschools, and not as much in childcare and out of school programs, for example, before care, after care, summer camps. So that's how this project came about. And we're here to help, as I said, families, professionals. Everything we do is English and Spanish. And so we now have, oops, I see a little typo there. We now have professional development available for you in NJCCIS as well. I put this slide here. I'm not going to go over it because we don't have time. I'm actually working on this tomorrow. I'm speaking at the NJ PEEP conference, which is the inclusion for preschool education. And so it's those child study teams and the PERS and so forth at the district who are going to this conference. And I just wanted them to understand how this is a challenge for families too, just like you're seeing. I want them to know that professionals and families are looking at this journey that they didn't know they were going on. And it's even harder for those who come from other cultures, who come from other countries, or even other states where it's different, and those who speak a different language to begin with. So I really want to help everyone understand how to wrap their heads around this for families and professionals. And with that, I'm going to turn it over to, is it Mita next?
Paulina is going to go
Oh,
next.
thank you. I'm turning this over to Paulina. Thank you. We're in very good hands because Paulina does this on a state level too. So thank you. Go right ahead.
Thank you, Allyson. I am going to share that I'm having technical difficulties. I cannot see the slides. However, I'm just gonna go for what we have in the background. So my name is Paulina Vargas. As Allyson stated, I am the bilingual trainer and TA specialist for the New Jersey Inclusive Child Care Project, as well as I work also for Family Rep. But I do want to share that I'm also a parent with a child with special needs, and there's the reason why I am involved with SPAN. And of course, SPAN is one of the important nonprofit organizations that parents like myself benefit from the support. So I'm going to start on the slide that, and like I said, I'm sorry, I have technical difficulties, so bear with me, please. So we're gonna start here talking about the special education Part C and Part B, where Part C and Part B are two parts of special education that serve children at different ages. Part C supports children from birth to age 3 using a family-centered approach through IFSPs, Individualized Family Service Plans, for whoever doesn't know what an IFSP is, while Part B serves ages 3 to 21 through an IEP, which is the Individualized Education Program, and focus on education and access to curriculum. This means early identification, strong referrals, and smooth transitions at age 3, and critical to ensure children receive the right support on time. We're gonna see now the next slide where we talk about the transition and how can be this overwhelmed for families. The transition at age 3 can feel very overwhelmed for families and for the programs that also, we as parents received right at the time. This is really critical developmental period where what we do early truly impacts long-term outcomes for our children. Timely support matters, delays in referrals and services can affect child progress. Families often need guidance to understand the process, the rights, and next steps. And the reality is systems can be complex, especially when coordinated between early intervention and school-based services for any families. We're going to move to the next slide, and we're going to talk about the planning ahead for transition from early intervention. Planning begins early, between the ages of 2 years and 3 months, but no later than 2 years and 9 months. A transition meeting is scheduled and a plan is developed, often during an IFSP review. The service coordinator and an IFSP team work closely with the family to prepare them for the next setting, whether that's a preschool program or other or early childhood services. By the age 2 years and 11 months, evaluations are completed and eligibility for preschool special education is determined. This timely ensures there is no gap in services and that children continue receiving support as they enter school-based programs. For program leaders like yourselves, this means having systems in place to receive referrals, collaborate with early intervention teams, and be ready to support children right at the age of 3. We're going to move into the transition planning and the next slide, where we're going to discuss, as part of the transition planning, there is an important step around sharing information from Part C to Part B. And this is where families can choose to opt out by default, limited information such as the child's name, age, and town. Is shared with the school districts around 33 months. Families can opt out, but they must do so around the IFSP closest to the child's second birthday, or within 10 days if they enter early intervention later. Once a family opts out, they cannot opt back in through this process. And let me clarify these misconceptions, right? Because even if the information is shared with families, are not required to move forward with the special education at age 3. They can choose to do nothing. And if they previously opted out, but later changed their mind, they can still refer their child directly to the child study team at any time. The main downsides of opting out is lost time. It can delay the evaluations and services, which may lead to a gap in support during a critical developmental period. It is important to remind families that only basic information is shared, and at this stage, there is no diagnosis included. It is critical to ensure that families understand their options clearly so they can make informed decisions without unintentional delayed services. And we're going to discuss now in the next slide about how can families focus and the child, right? So under the Individuals with Disabilities Education Act, or IDA, children may receive services through 2 systems, Part C and Part B, and there is significant shift between them. The biggest changes is moving from a family-focused model from early intervention to child-focused educational model to the district to schools. Part C, it starts at age 3. It starts at age 0, right, when the baby is born, to age 3. Services are provided through early intervention under Part C. These services are guided by an IFSP, which includes the needs of both the child and the family. Services are delivered in natural environments, and families work closely with a service coordinator. The IFSP team typically reviews progress every 6 months. Part B starts at age 3. Services shift to Part B, which is school-based. Supports are delivered through an IAP, focuses specifically on the child's educational needs and access to the curriculum. Services now take place primarily in the school setting, and the services coordinator role transitions to a case manager. The IEP is generally reviewed annually. The shift can feel significant for families as the systems, language, and expectations all change for them. Understanding the shift is critical to supporting staff setting expectations and helping families adjust to a more structured school-based system. On the next slide, we're going to review what the process is for to obtain an IEP. So let's talk a little bit very briefly about the cycle. Step 1 begins with the referral identification when concerns are identified. Step 2 then comes evaluation with the parent's consent. Step 3 determines an eligibility for the child. Step 4, if eligible, an IEP is developed to outline goals and services. Step 5, next is implementation, where services are provided within 90 days from consent to evaluate. Step 6, monitored, we're going to monitor the IEP. And finally, step 7, annual review, or to determine if the child needs to be reevaluated after the 3 years. And that's called the triennial reevaluations. This is an ongoing process, ensures the services and responsive to the child's changing needs. This means ensuring your teams understands the process, follow timelines, and maintain a strong communication with families throughout. And the next slide, we're going to see how we identify and how we planned at the meetings. After referrals, the school district invites the family to an identification evaluation planning meeting. Purpose of the meeting is to review existing information about the child, decide if more information is needed, determine if an evaluation is needed, develop an evaluation plan if eligibility is possible. Meeting must occur within 20 days of referral with the parent, child study team, and a teacher familiar with the district programs. Child study team includes a school psychologist, learning disability teacher, consultant, a school social worker, and for a 3 to 5, a speech language specialist. If evaluation is needed, parental informed written consent is required before any testing. Informed consent means the parent understands, agrees in writing, and can withdraw consent at any time, not retroactive. If your child is not eligible for special education and related services, your service coordinator will help you find other opportunities for young children in your community. For example, school districts, early childhood programs, private schools, or Head Start, or even child cares. And the next slide, we're going to talk about the eligibility meeting. If a child found eligible, a child study team member is assigned as the case manager. The case manager helps with developing the IEP, implementing the IEP, reviewing the IEP, coordinating meetings with the family and school staff, serving as the main contact for questions. A student is eligible for special education if they have one or more defined disabilities. The disability negatively affects educational performance. They need special education and related services. On the next slide, we're going to talk a little bit about the meeting and individualized education program. Once a student is evaluated and found eligible, the team develops an individualized education program, an IEP. The IEP meeting brings together key participants, including the parent or the parents, case manager, general education teacher, a special education teacher, additional experts if needed. And if the parent has another native language, the parent has to be provided with language interpretation. The IEP is written plan agreement between the school district and the family. It describes the student's educational needs, services, and supports based on an evaluation results. The goal of the IEP is to ensure the student receives appropriate instruction and services to support progress in school. And I am going to pass to Mita in the next slide. Thank you so much for having me today.
Thank you, Paulina. Are you guys all with us? Good? Good to move forward. My name is Mita Bhattacharya. I am an early childhood inclusion coordinator on the New Jersey Inclusive Childcare Project, and I also work with Paulina on a different project that is working with the Special Child Health Service Case Management Unit. And we are going to talk about those resources later. But as of now, what you have heard Paulina mentioning that being eligible for special education. So not everybody who are coming from the early intervention will be eligible for special education. It all based on the evaluation reports. Having a medical diagnosis does not guarantee unless the evaluation reports shows that the child's current condition impacts their performance in the school setting. So the special education process itself is very complicated. So if you are not understanding each of these steps, it's absolutely understandable. So, getting through going through the slides and processing all this information will help you to understand these steps better and also help you to help the families. So now I'm going to talk about that what it means when a child is found not eligible for special education services. And most importantly, what families can do next. I want to emphasize that outcome does not mean that the child does not need support. It simply means that they may not meet the criteria under special education at this time. So what are the practical steps that families can take? They are going to be with you, so you are still going to support them. So I encourage you all to guide families in asking schools about general education supports and intervention that can still be put in place. Exploring a 504 plan. A 504 plan is different than an IEP. It is not a special education plan, but it talks about accommodations. That means how environmental barriers can be removed to make meaningful inclusion in the classroom. There are, a lot of accommodations can be done in the classroom setting. For example, if the child needs to be seated, close to the teacher or away from the group, just to, limit the noise distraction or giving them multiple breaks through the class, having them extended time for their assignments. So there are multiple ways to create accommodation plans. And also it's important to continue to monitor the child's development and progress and not taking a wait and see approach without support. So families should be encouraged to consider maybe some community-based services, like, if they can access speech therapy, occupational therapy, behavioral support through their medical insurance, or, in some other getting connected with Perform Care, understanding how FSO can support family support organization. They also provide a lot of community events. So, enforcing the value of ongoing communication and both with teachers and private providers to make sure that the concerns are being consistently addressed. It's also important for parents to know that they can always request a reevaluation. At this time, their child is not eligible, but that does not mean that they cannot request for reevaluation. If there is any, special concern pops up, if the child is showing regression or if there are some behavioral issues coming up, a parent can always request reevaluation. Parents also have the right to disagree with the district's decision. I may say that, okay, that as per the district's evaluation report, my child is not eligible, but I have the parental right to say that, okay, I do not agree with your evaluation report, and hence I am requesting an independent evaluation at the public expense. And in that case, the district will have only two options. One is grant the independent evaluation, or they have to file due process and they have to prove that their the evaluation reports are appropriate. They cannot just say that, oh, we do not want to provide independent evaluation. That is not an option on the table. Parents' concerns can be raised at any time. Parents do not have to wait for a specific timeline. I also want to mention here that you can call SPAN at our warm line for individual assistance. Our warm line family resource specialists can talk to the families, listen to their concerns, and give them resources and help them understand their options as they are navigating the system. Also encouraging parents to register with the county's Special Child Health Services Case Management Unit. Each county in New Jersey have Special Child Health Service Case Management Unit. One flyer will be attached with your resource folder, so you will have better idea, but I just want to make it familiar to you all that there are special child offices in each county, and when the child has a diagnosis or a concern of developmental delays, they can reach out to the special child and have their child registered with them. And they will be assigned a case manager who will be guiding them with any issues. But when it comes to education-related, special education-related concerns, the parents can request for SPAN referral, and our family resource specialists will be able to hold the parents' hands and guide them in this system. And we have 3 family resource specialists working with all 21 case management units through the state. Paulina oversees 7 counties. I oversee 7 counties, and we also have another project member who does the rest of the 7. So these are the ways you can continue support the families if a child is not eligible for special education. We can move to the next slide, Allyson. So I'd also like to focus on practical ways to support both students and families so that they can be empowered. And this conversation should be naturally centered around how, as professionals, you can build confidence, clarity, and collaboration with the student, with the families. So supporting students' voice and growth from an early age is very important. You can work with students to help them understand their strengths. And again, at 3 or 4, you do not expect that, they're going to be do the self-advocacy as an adult, but at their level and depending on their communication ability. So finding that strength and helping the student understand what are their strengths, what do they like to do, what are their favorite things to do, what they like to do in the future. So encouraging them to share their dreams, their goals, their preferences in a realistic expectations, of course, is essential. Also, guiding and empowering families. It's critical that you will be able to explain each step of the process so families do not feel overwhelmed or confused. Creating a safe, welcoming space for questions is essential, so that parents feel that they are being heard and they have a safe space to have a conversation with you, especially when they are finding that it's the district is not supporting them. They're receiving pushbacks from the district, so they need your guidance, they need your support. Also, helping them understand that how communication and documentation is important. Putting, requests in writing, their concerns in writing, submitting them in a formal way, not just always, having a phone conversation with the school districts, but documenting their conversation, documenting their concerns, keeping paper trail, understanding child's growth and progress, and regular updates. So keeping all these, paper trail always helpful. We have heard families saying like, oh, he does this all the time, or, out of nowhere, this is how he's, behaving. But again, understanding that, if you say all the time, what does that mean? Our SPAN also delivers family data leadership training, which is a very important, training we offer, helping parents understand that how important data is when it comes to decision making. So, these are the practical ways you can continue to offer your support to the families. We can go to the next slide, Allyson. So our project, New Jersey Inclusive Childcare Project, we offer multiple things for parents as well as for professionals. So our trainers and the technical assistance team and our inclusion coordinators team, we work with families and offer parent circles. Those are, informal discussion based on popular topics. Throughout the year, we offer 4, 6, Allyson, correct me if I'm wrong. I think 4. Both in English and Spanish.
Sorry, I think we do 4 or 5 in each language, usually
Yes.
the topic in English and in Spanish. And in the coming year, I think our contract with the state says we do 4.
4, yeah. Right. Thank you. Thank you, Allyson.
We'll add them when they come up sometimes, but at least on the schedule, we'll have a set schedule of them and for the year to come.
Yes, thank you, Allyson. So our topics are usually like, when we hear parents want to know about toilet training tools, or, what they can do when they see that, siblings are not getting along, or some, routines, how they can incorporate routine in their daily schedule to help kids understand the transition or make the transition a little bit smoother or meaningful. So there are multiple topics that we offer for discussion. We also offer positive solutions for families. These are the evidence-based 7-week program that is based on the pyramid model, and it addresses the children's social and emotional growth. So our next offering is coming up in May, and we are requesting, and we will share the flyers with you, share with your families, and they will have handy tools and understanding to manage behaviors and why the behaviors happen and how to address those behaviors at home, so that parents will feel empowered. And on the other side, we work with professionals, and we offer professional developments through NJCCIS, so that our team members are approved trainers, so you can get your credits. And we also offer other virtual PD sessions. We offer on-site visit. We just like we were invited today, we get invitations from many other organizations. We talk about our early childhood, initiatives. Also, any particular topic that you'd like to know from us, please reach us out. We are a phone call away or an email away. So again, the warm line number is available here. I already spoke about that before, but feel free to use our resources like our Eventbrite page. Those are, a list of events, what will be delivered in the future. And, a lot of resources on our YouTube channels, our SPAN website. Okay, we can move to the next one. So parent involvement is very important, and would like to stress that when a parent is actively involved in their child's educational journey, it's a wonderful thing that can happen, not only to that specific child, but also to the system. I am also a parent. My son is on the spectrum. He's 20, he's in college. But I see this, having this involvement in my school community, how it helped my son, also the system, because once you are involved, you see what's happening inside the school, you see what is impacting other students. So it might not impact you directly, but how it might benefit other students. So having understand all these pieces in the system always help. So joining PTA meetings, if parents cannot be a committee member, but they can always get involved in their in the parent-teacher association meetings, or volunteer at their events. Each district in New Jersey should have a special education parent advisory group, or CPAC. And parents should be encouraged to attend those meetings, join committees. There are multiple committees in each district. There are Early Childhood Advisory Committee, or ECAC, and parents can, if they cannot join those committees, they can at least go to those meetings and listen if their advocacy does not come natural to many parents. So that's why just going there, listening, they might not want to speak on the very first day, but they should listen. And then, requesting for parent training, like SPAN has so many parent training available on their YouTube channel. Parents can take advantage of all those free resources very easily. We can move to the next one. So this resource was created by the Bach Center on Disability and Human Development by Rutgers Robert Wood Johnson Medical School. And this is a great resource that connects you to the community agencies. And each, you can see that, and we're going to share this flyer with you. It can have many different components, like, when it is concerned with their health, or when it is concerning about the early intervention or preschool, mental health, any kind of referral, or, here again, they are adding special child health case management unit. So if you click on these links, it can take you to multiple resources, and it's a great tool to have in your toolbox when you are helping families. And the cool feature is that it can be available in many different languages, so parents so that parents feel much more supported that okay, these informations are being shared in their native language. We can move to the next one. Awesome. So this one will be shared with you, even though these are, sections by age, but you can, use any of these resources as per your need. These are great tools to have to share with your families, or share with your colleagues when you have time. Go through each of these resources, empower yourself so that you can guide parents when you need to. We always use these resources with parents, and our goal is to make sure both the sides of the traffic is getting information and they're empowered, so that when we have this collaboration with parents, we are talking the same language. Next slide, please. Okay, here again, our SPAN worm line. Our website is also listed. Please feel free to use this. This flyer is also available. You can always reach us out through phone or through an email. If it is specifically related to your role, early childhood initiatives, our New Jersey Inclusive Childcare Project can help you. If we cannot help, we can definitely connect you with our other project. We have a lot of projects under SPAN umbrella, and everybody is very familiar what they are, and they're really good what they are doing, and everybody has lived experience. So we can connect with families very easily, and also professionals who are serving the families. Okay, so you can put it in the chat box, or you can tell yourself if you are not ready to share with all of us that one action that you will take to better support families during the transition at age 3. So it's important for you to process everything, and then come up with that one thing, at least one thing.